you have any questions before we start?
The flora, you 4 days on, 4 days off till the bottle's gone, right?
Yes.
And then by the time I'm done, I just ask you if I need
And
more?
we'll look at your tongue and see if you need it again.
Okay,
The idea with the Flora Plus is to help you reestablish friendly
This is if you
flora
recommend
in the
anybody
small
recommend
intestine.
that we should put on
That's
anybody.
a good question. That's one of the best products I know of to help strengthen
I'll put
your
it there,
immune
I'll get my kids'
system.
email.
Okay, now, I apologize, we got started a couple minutes late. I'm going to pass this around first. This is a test.
Yes.
I'm going to give you all the answers to the test. So the TZone. The TZone is officially, get a move back here, Deborah. Is whole body vibration. The concept was created by Russian medical science doctors to solve a problem that existed within astronauts when they would go out into space in weightlessness and come back having lost bone density. And as you know from prior discussions, if the bones are weak, the body does not make enough stem cells. When the body does not make enough stem cells, the body becomes weaker and weaker and weaker. They also come back with muscle atrophy. That means they get skinny. The muscles don't work like they should. That then creates other problems. So it takes them a long time to recover upon return from outer space. The assignment was to create a device that they could send with them into space that would help solve both problems. They came up with the idea of whole body vibration. It solved the problems. Word got out. The Germans learned about it. They said, okay, we're going to capitalize on that knowledge. So they integrated whole body vibration into the regime of exercise, and the Olympic athletes. They become stronger, faster, bigger, in less time. Then other universities found out about it, medical schools. Professional athlete and college athletes, they started to do a lot of work with them. So since that time until now, it's become one of the most researched type of exercise there is. It's very, very valuable. And they're now made and sold all over the world. People use them a lot. I went to a medical conference in Denver a few years ago. I think it was 1 or 2 chiropractors. They're all medical doctors. They had 2 of them. One sold for $16,000. One sold for almost $20,000. They did the same kind of thing, that is create whole body vibration. With the medical doctors, who were physiatrists, that means they work on strengthening and aligning the body, they could bring them into their office, have you stand on the machine for 12 minutes and bill the insurance company $150. They could do that 3 times a week for 12 weeks. So they were very excited about their earning potential. Now, I don't recommend you only use the machine 3 times a week for 12 minutes. Today, I'm going to recommend how to use it to get the very most value out of it. So you'll understand the concepts and the techniques of how to use it. It does both aerobic and anaerobic exercise. Now, let me explain the difference. If you want to lose weight only, anaerobic is very inefficient. Think of anaerobic like having too much gas in your gas tank and you want to burn the gas and get rid of it. You start up your car and you run it for 3 minutes and you turn it off. When it's cold, it burns more fuel, more gas. You know that, you old people, right? When it starts in the winter time and it's cold, you put the choke on. We used to have an old Ford, and you always had to pull the choke all the way out to get it to start. Once it got warm, you push it back in slow. Now it gets better gas mileage. So when you want to burn calories, 3 minutes, 3 times a day, you're burning a lot of calories. Because then the body then converts to aerobic. When the body is aerobic, you're burning less calories. So if you were to go to the gym, show by a raise of hand who goes to the gym for an hour. 1. Okay? Now, if you go to the gym and you exercise for 33 minutes, the first 3 minutes you burn, I'm going to just pick a number, about 100, maybe 150 calories. Then you exercise for another 30 minutes, you burn how much more? About 150 calories. So it takes you 30 minutes to burn the same amount as it did in 3 because you switch from anaerobic to aerobic. The good news is you can do both on the TZone. Okay? You don't have to go anywhere. Now, you can get what I call repetitive microtherapy in the comfort of your own home, and within 10 minutes, you can get the same value as going to the gym for an hour. You don't have to get dressed and go. I had a lady yesterday who does that every morning. I asked her how long it took from the time she gets out of bed, from the time she walks out the door, drives, does a thing, comes back, almost 2 hours, 5 days a week. That's 10 hours. That's a lot of time. So I said, why do you go? That's a lot of time. You probably have friends. Yeah, that's why she goes. It's like a social gathering. Okay, so if you need friends, a social get together, go to church. They need you there. But if you want to get healthy, you can do it in your home on the TZone. A lady who says, well, I've got an exercise bike, I've got this, I've got this, I've got this. Do you need all those machines? The answer was no. You don't need them. If you want to keep them, keep them. But you don't need them. You can do it all here. Okay, now let's go through that test. My reader is here.
Whole body vibration was first used with Russian astronauts in space to prevent bone loss and muscle atrophy.
True. Number 2.
It was then used in the Olympic training for German weightlifters and wrestlers for strength enhancement.
True.
Using WBV at home saves hours of training and gym time because 10 minutes on the WBV benefits are similar to what you get at the gym.
True. Better than. Okay.
One main reason WBV is so effective is it activates nearly all the muscles and reestablishes nerve pathways while promoting balance and alignment of the body as well.
True. Now I want to make a couple of comments. When you stand on the, we call it TZone, not the WBV, that stands for whole body vibration. It's easier in my mouth to see TZone. When you do that, the body automatically lines up and becomes more balanced. We want balance, motion, and then comes alignment. A lot of you go to chiropractic to get aligned, and you're out of balance. You have you don't have good motion. You do not hold the adjustment. I practiced chiropractic for a long, long time, and that was the biggest problem I had was for people to hold their adjustment. All the people who use a whole body vibration, number 1, can do most of the adjusting themselves with this and the other things they teach you, and you hold longer, so you don't need to keep going back and back and back. The other thing I want you to remember, this is in addition to the test, there is a continual turnover of all connective tissue in the body, which means that you're always getting new growth. when you use the T-zone or do the sacral slide, any of the other therapies they give you, we're not trying to fix the old broken down scar tissue or weakened tissue. We're actually training the new tissue to work more normal function. The other thing that's on that question is neuromuscular reeducation. You're retraining nerves, and that's a big deal. We talked about patterns, the patterns of posture. When you use the T-zone, you're retraining postural patterns neurologically. Now, one of the codes that the medical doctors use to bill for this is called neuromuscular reeducation. It has a medical code that they can bill for. You can do the same thing at home on your own safely. Does that make sense? Anybody have any questions about that? When we talk about balance, a lot of people have problems with balance issues. And that's a major problem for Medicare. Medicare is very, very concerned about old people falling and breaking bones. The older you get, the higher the chance of dying from a bone fracture if you fall. If you're over 85, they almost kiss you goodbye if you fall and break a bone, because you get secondary infection, and that's what kills you, not the fall itself. If you use a T-zone like I tell you to do, you're going to have better balance. You'll be able to have less falls. And if you fall, you'll be more resilient. Next.
Strength and endurance are more important than motion, balance, and alignment.
False. A lot of people go to the gym to get strong. Getting strong never happens if you're out of balance. The body has a built-in, similar to a governor on a motor, on an engine. It will only go a certain speed. That's the governor. The body, if the body's crooked, misaligned, you can only get so strong. It won't let you get stronger unless you get more balance. In fact, I'll tell you a true story. I had a patient in Colorado Springs who came from the Olympic Training Center. It was a German weightlifter. Most weight he had lifted with the type of weightlifting he did was 405 pounds. He came into my office on Friday. I checked him. His hips were crooked. He was misaligned. I lined him up. I knew he wouldn't stay, so I propped him up with a little lift to hold him balanced. He came back on Monday, walked in the office, walked over to me and grabbed me. He grabbed me by the chest and scolded. I thought he would kill me. I thought he was mad at me. He said, "I'll talk to Smith. I love you." Good. Why? He said, yesterday, Sunday, he lifted 450 pounds, 45 more than he had ever lifted in his whole life, only because we balanced things. And we left the left in for a while until he stabilized, and we took the left out. And he was very strong. Okay, next.
It has been proven that the use of the WBV can aid in the reversal of osteoporosis, bone softening, and arthritis.
True. So some people are told, "Oh, you've got arthritis. Congratulations, here's a patch, you can wear it for life. You're gonna have arthritis your whole life." If you line up the joint, lower the stress, immobilize it, your body will build a new joint. Medical doctors, especially orthopedic surgeons, love this line. It's a marketing line. You have bone on bone. That has a nice ring, right? Bone on bone. You have no other choice. We need to give you a new joint. The good news is your body is smart enough, has the ability to build a new joint if you allow time, do repetitive realigning, microtherapy with micro motions. Okay?
The use of the WBV is effective in strengthening and improving endurance, much the same as the use of weight.
True.
Aerobic exercise can be easily done on the WBV simply by adding motion to the few basic positions.
And time, true.
The maximum time per use on the WBV is 10 to 12 minutes.
True. All of the machines start at 10 or 12 minutes, go down and shut off automatically for that reason. That's enough time. Most people who I put on the machine now have only do for a few minutes to start with until they get strong. When they get used to it and get more balance and more aligned, the joints get used to the G-force, they can use it for multiple times. Okay, let me say carefully. It's better for you to use it 3 or 4 minutes more times than one time for the full time until you get in shape. Then you can use the full time. I like to use the full 12 minutes every morning. That's part of my routine. And I recommend to all of you that have a machine that you establish a routine. There's a time and a place, and you do it every single day if possible. At least I recommend you not skip 2 days. So do it. You can skip a day if you want, but don't skip 2 days. Do it every day, at least some. It's best to do it first thing in the morning to align you, last thing at night to relax you, so you sleep.
Due to the intensity of the value, it is best to start on a slower speed with feet closer together.
True. Close means about 5 inches with the heels, 6 inches with the toes. If you've had knee surgery, hip surgery, and you can walk, and you can go up and down stairs, you can safely use the whole body vibration on a low speed. As you get stronger and build better tissue, you can then widen a little bit. You can modify the foot alignment for your ankles, knees, hips, and lower back. And you can use a little higher speed. And we're going to talk about the speed in a few minutes.
At higher speeds, the body gets a massage-like benefit, which can enhance sleep value.
True.
Many users claim that the T-Zone is one of the best investments they have made for their family.
I hear that often. That's very true.
Focus always on balance at the start to finish, speed 1 to 10.
So the slow speed at the beginning and the slow speed at the end, it's easy for your body to achieve balance on the slower speed. Here's why. Every time that the surface tips, if you're made out of wood, your head would go way over here, then over here. But it's not. It's adaptable. So you can, when it tips, the body on its own automatically tries to stay in the middle. And that relaxes you and aligns you. So it's a good programming back toward normal. Now, you've all seen little one-year-old children learning how to walk. What they're trying to do is balance their head over the body. And once you pass 65, that then becomes the same problem, balancing the head over your body. This is a normal posture. Balance, both from the front and from the side. That's the ideal. By divine design, that's normal. And that will happen automatically. You're programmed to be like that, unless you reprogram by bad habits.
I have a question before we go on. The question beforehand on the test was about the high-speed massage.
Yeah.
So you do the strengthening lower speeds in the morning and the higher speed massage at night to help you sleep better?
We have the
Or are you
next,
addressing that later?
the next handout, we're gonna cover that exact
Okay.
question.
Perfect.
So let's, is that the end?
No,
One more?
there's a list.
Oh, they can read that.
Okay.
So this is worth gold to you. increase in value, take one down and pass it around. Sometimes your friends will buy TZone from somebody who died or went on a mission, and you can, and they don't know how to use it. Yesterday class had a couple of had a whole body vibration. I don't know if they bought it at Sam's or Costco, but they got it and they didn't know how to use it. And so they learned how to use it. This will help anybody learn how to use it. By the way, Sam's and Costco sell a machine that looks exactly like this. Comes out of the same factory. It's a different name. I think it's called Zaz, Z-A-Z. It sells for $2,600 to $3,400. Exactly the same, different name.
We got more tests, we need the other thing.
The TZone.
The
They're
TZone.
coming.
They're
Oh,
coming
okay,
around.
because you handed us more tests.
Or did?
This
Yeah.
one.
Maybe he thought you needed to learn.
You probably thought it was one first.
Maybe he thought you didn't get it the first time.
I do get confused at times. Okay, this says TZone whole body vibration. So we're gonna divide the body into regions. Specifically for the purpose of helping you who have problems with the different regions of your body. We're gonna start at the top and work down. If you have any questions, please ask. I'm gonna give you a lot of information quickly. So I have a few models of bones. I'm gonna pass them around to help you get a visual of exactly what we're talking about. So I put the words combine frequently. You can do 2 or 3 or 4 of these different regions at one time. I'll go back and review that with you. Now, to make this more better for you, I would like to have somebody serve as a volunteer to stand on the TZone and be a model. This is your chance. Lifetime opportunity to be a model. Come on up.
Come on down.
Come on down.
You win the
Oh,
prize.
you're already dressed for it. Yeah, that's good. Now, the risk you take, stand up on there. The risk you take is, I'm gonna talk for about 12 minutes.
Okay.
If you have not been using your TZone faithfully, tomorrow, you'll be very sore. Okay? And you can blame yourself for not using your TZone more often.
You can take full responsibility.
Okay, now, you can turn around if you like.
Okay.
That way it doesn't look like a Joe commercial. Okay, so how much can you move around, Deborah? Can you move here and back? Okay, upper neck. So I have 2 upper necks here for you. The very upper neck is where rotation occurs. Rotation occurs in between C1 and 2. So what we're gonna do, I'm gonna turn it on and she's gonna demonstrate. So you just do what I tell you to do, okay?
See what I can do.
Promise? Okay. You'll be the only one. It does everything I told him to do.
I'm not gonna break my promise then.
If you don't, I'll forgive you, okay?
Okay.
Okay, so when they turn it on this machine, it's going to start at the speed of 1. We're going to leave it on 1 the whole time. And the directions, I recommend you change position about every 15 to 20 seconds. You do something different. You know, anytime you do anything different, everything changes. That's one great thing about the T-Zone is different than a gym. If you go to the gym and you lift a weight or you push a weight, you're only doing a few muscles. You're doing all the muscles. And the reason you don't get sore is you're using all the muscles a little bit, not a few muscles a lot. And that's repetitive microtherapy, which over time helps to become better and better. Having said that, now keep those because I want you to look at the middle neck and the lower neck. I just want you to look at the upper neck first. The T-Zone will do you more good 6 months from now than it is today. Why? Because your body will be stronger. And the better you get, the better you can get. The better you get, the better you can become. Okay, upper neck. So to do the upper neck, you stand tall, bring your feet a little closer together. 5 on the back, 6 on the front. Chest up, rear end up, pubis down, eyes level. Look at the picture, eye level. Now I'm going to turn it on. Because we're doing the upper neck, I want you to rotate your head. Rotate means turn left. You stop at the point of pain or restriction. If the pain is a 5, don't go any further. If it's a 1, 2, 3, or 4, you can go that far. Now turn to the other way. That's upper neck. If you want to improve the upper neck motion, you do that 3 times both ways. Now mid neck and lower neck. You tip the head. I call it pivot. You pivot the head like you have a rod through your head, ear to ear. You tip the head down, just the head, not the neck. Pivot, that's good. You pivot down, now lean the neck. When you lean the neck, now the bones in the middle of your neck slide forward, and you open up the facets on the back. Now head back up, pivot your head back. Now lean the neck back. When you lean the neck back, look at those joints. When you lean the head back, the joints slide back and down, and you open up the discs. So you do disc therapy. Now look straight ahead. Now we're going to do the shoulder girdle. We open and close the shoulder girdle by doing motions. This is closed. This is open. Open, close. The ribs live inside the thoracic girdle, lives on top of the rib cage. It sits right up here. Most people have problems with elbows, shoulders, wrist, have problems with the shoulder girdle. It doesn't slide around forward and back. You can do, I'm going to show you some more things. I will show you later how to do this kneeling down in front of the machine. But for right now, just put your arms up and close and open. Close and open. You want to slide the shoulder girdle around and back, around and back. You can also do, this is not on the form, the position of Y. Bring the shoulders back, go into a W, now down to a L, and then a T. When you do a T, put your arms straight out, reach up with your hands, with your wrists, with your elbows, with your shoulders. Now turn them over. You do that a couple of times. That helps get a lot of motion, balance, and alignment, and whole upper chest, arms and hands. Okay?
So do you hold those positions for 15 seconds?
A few seconds.
Oh, few seconds.
You can hold a combination of about 15 or 20. Now torso, the ribs, that's it, the whole chest. When I do an examination on people and I measure the chest, normal range of motion from out to in should be 2.5 to 3 inches. I rarely see that. Why? Because the spine is curved, the ribs are stuck. This motion that she's going to do will help correct that and give more lung capacity. Next week we're going to talk about detoxification. The lungs should give about 70% of the cleansing of the body, but only if the chest moves properly. So when the chest moves, it moves deep. Deep means front to back. So take a deep breath. Now turn the upper body one way. Hold your hands here. Turn the upper body. When you need to breathe, come back. Breathe a time or two. Take another breath. Turn. Lead with your head. Lead with the head.
With my head,
Yep.
this way, okay.
Now back. Now you can do 3 different breaths. Deep, wide, belly, and do that motion. You can also invert it. By inverted, I mean you can turn, and then breathe. Deep, wide, and belly. If you want to focus on that region of your body. Now, any of you have any kind of digestive problem, stomach, liver, pancreas, small intestine, large intestine, mobilizing that area of the body will always help nerve flow to those organs. That's a very good thing to do. And again, you go to point of pain or resistance. When you do an exam, we classify reduced motion and limited motion. Reduced means you could go further, but you didn't. Limited means you went as far as you could. I recommend that when you do any of these, you think of restricted. Only go to where it's moderately restricted. Okay, now the low back. The low back is designed to primarily flex and extend. That means go forward, so go down, touch your knees, head down. Let it stretch, then come back up, all the way up, and lean back. I'm going to pass the spine around so you can look at the low back design. The joints in the low back are at this angle, front to back. Up here in the ribs, the joints lay flat so they can rotate. Down here, they're designed to go forward and back. That's why people hurt their back when they're starting a lawnmower, when they're vacuuming the house, because they rotate those joints, and they shouldn't do that. They primarily go forward and back. And if you have a back pain from working out, doing anything, and the low back is tight, always lean into the pain. You want to shorten the tight muscle. So if the pain is on the right low back side, like you were today, you lean into the right, your low back was tight, your body was trying to pull you back up straight. What's help? The muscles are too long, they're weak, help them so you lean back into that side. You can take a look at that and pass it around. Okay, any questions about that? Now into the pelvis. Standing or sitting, we want to rock the pelvis. Pelvis down, pelvis up. Most people can have a hard time doing that. You can do it straight, you can also turn 45 degrees and do it again. Pelvis down, don't lean, just tip the pelvis. down, up. See, her pelvis alone is moving a teeny bit. That will improve, with time. The ligaments will get more stretchy. That will help the whole body. By the way, the body has about 206 bones. They're all held together by ligaments. You have about 800 ligaments in the body. All bones are held in contact with another bone as a ligament holding it in place. Those ligaments with disuse change from yellow to brown. They become dry, they become more brittle, more likely to tear or rupture. When you use the TZone, they gradually change back to more yellow and become slightly more mobile, more stretchy, more like a cable than a chain. Okay, now the femur head. A lot of people have hip replacement. By the way, Iowa Falls is a good place to do that. We have a lot of surgeons that love to do hip replacements.
Yes, my friend had ruined her.
Hips and knees.
The thing I want to tell you about any kind of surgery is you can't undo it. But the body can rebuild a new joint. Now, orthopedic surgeons will probably tell you, no, I can't do that. I'm going to tell you a true story of a patient who did that. And I'm going to stop when I tell you the story. Her name was Helen. Helen came to me one day with severe hip pain with a bad limb. How long have you had the pain? Oh, a few years. I took a picture of her pelvis and her spine. The hip joint was grossly infected, the joint space. The bone, the femur head also was very broken down. It was set around, it was flat. And I said to her, Helen, you need to go get a new hip. And she says, no. I said, you need to go get a new hip, because if you don't get one, you might sneeze one day or slip on the step and the hip will fall out of the socket and slide up here. You wish you were dead because of the pain. She said, no, you fix it. I said, I can't fix that. She said, well, I'm not having surgery. So there. What are you gonna do to help me? I said, is your husband handy? Now I'm thinking like a farmer, not a doctor. She said, yeah, he's pretty handy. I said, okay, go buy a pair of high top tennis shoes, have him drill a hole in the bottom, put an eye hook on it, put a rope on it, put a pulley on the end of your bed, and we'll put a bag of water to pull your leg during the night. So every night you go to bed, you put your shoe on, you get in bed, and you can move around. It's going to pull your leg and open up that hip joint. She said, I can do that. I said, go do it. So we did that. She did that for almost a year, and felt better and felt better and felt better. I said, Helen, we need to take a new x-ray of your hip. I had no idea what we were going to see, but I was totally impressed with the body when I saw what happened. The flattened femur head had rounded up. It developed some cartilage, new cartilage tissue. The socket had grown an extension more than an inch to make the joint that was flat longer and wider. So now she had compromised motion in the hip with almost no pain. I gave her a little lift to help balance her like I did the weightlifting guy. And she went about her life almost free of pain, slightly, almost free of pain. About a year and a half later, she came in like this. I said, what'd you do? She said, I broke my arm, both bones. Fix it. I said, no, Helen, you broke both bones. If you slip and fall and do something, you could sever an artery or nerve, and you could do, you know, you'd be in bad trouble, so just go have them pin it. She said, no, you fix it. So I didn't do anything other than coach her and help her for another several months. Her bones healed, she had no nerve problem. Her wrist was not pretty, but it worked just fine. So the body can fix major problems.
Can I interject here?
Yes.
It was interesting at the end of when Helen's arm, wrist were healed. I think of it as Afghan Day, because she came into the clinic and said, you get an Afghan, you get an Afghan, you get an Afghan. All of them she had done as part of her therapy for her arm to improve her motion while she was rehabilitating that.
Thank you for sharing that. Yeah.
That's awesome.
That's not, they didn't come from Afghanistan. She made it.
Present day
Okay, now the hips. When you do hips, you want to get into, it's a ball. You want to do hula hoop in the hips, slow motion. You can do both ways. You can, when you get strong, you can do it on one leg at a time. Do the weight, the one with the weight on it. Do this one.
Do you want it moving?
This
You want to move
one?
this,
The leg you're standing
Yep.
on.
the one you're standing on.
Oh, move your hip like this?
Yeah.
Oh, I see.
No. And you can turn. You want to do multiple, gentle, slow motions. Now, why slow? When you move fast, your body will use only about a small portion of the fibers. When you move slow, you get what's called recruitment. You recruit more nerves, and you recruit more muscle and tendon, tissue. And when you do repetitive motion, you build new tissue. We're training the new tissue again. Okay, now the knees. The knees, we're going to flex the knees and rotate slowly. So we take the hula hoop down to the knees. Whenever you bend the knees and do hula hoop motion, always point the feet in the primary direction of the knees. So if we do out, like a cowboy, toe out, do circles, that's a different effect than if you toe in. Same knee, same motion, different position, different value. We good? Do slow, easy. How long?
15 to 20
About 15 to 20 seconds. Now we do the ankles. When we get to the ankle, the primary motion of the ankle is straight up and down, right here. The ankle joint should be level with the earth. Level with the earth. And we want to do this with the foot. We're going to bend the knee, this tibia to move forward and back. Now to make it easy, turn sideways. Whole body. Turn, keep turning. Sideways. Now, if I turn it on right now, she's go this way, but now she's close to the middle. Now it's pivoting the foot like this. If she moves back, move back a little bit. Now it's doing more this. Now move forward. Now it's doing more of this. You see toes in, toe out. Modifies it. If you go up on your toes, it does different position. That helps the knee as well, and all the bones in the feet. Any questions about that? Okay,
So every position you hit, you stay for 15 to 20 seconds
About.
on your toes.
about,
15 seconds goes fast.
about, it's all about. Now, I'm gonna pass this around for you to look at. This chart shows the number of motions, it's called hertz. That means how many times it's moving per second. That's a column on the left. The big chart on the right shows the different speeds on the programs.
That's in our book, isn't it?
It's in the book. It's in the book.
Okay.
Now, do you have any comments or questions before we have Joyce get out? Okay, thank you very much. You make a great model. Okay, now, I've indicated that to create a routine. So decide what you're gonna work on, like the neck, the knee, the hip, the low back. And I'd like to encourage you to think of the different body parts with the function. Most of you have this chart right here that shows the different nerves that go to the different organs of the body. If you have a problem, like I said, with digestion, work on the ribs, the torso. If you have constipation, prostate, female, kidney, continence, work on the low back, pelvis. I had a car accident in 2016 from the rear end. It tore my neck. It tore the ligaments in the neck. I went to my stake president, who happens to be a radiologist. He took pictures of my neck moving. I had him do a special study. I said, what do you think I should do? He said, go get surgery. It won't repair. I said, thank you. I came home and did what I told you to do. That was a few years ago. Today my neck is almost perfect with full range of motion because of new tissue has grown. Okay, I could tell you a lot of stories, but that's summary. Now, speed. This is a general concept. The slow speed, 1 to 10, is for motion, balance, and alignment. When we go past 10, now we're building strength and endurance. So if you want to get tough, build muscle, I recommend you go to about 15, but only do that when you get better aligned. Then if you want to get a massage at bedtime, take it up to more than 20 and do it for a couple of minutes to relax you near bedtime. Now, this unit has built-in programs. That sheet I passed around to you showed you the speeds of each program. For example, it has 8 speeds. You push right here, 1, 2, 3, 4, 5, 6, 7, 8. I like number 5. I use number 5 every morning. So when you turn it on, you push this button, and it starts at 25. We'll go for full 12 minutes and shut off. So I combine a lot of the different things that I showed you, that Joe showed you. I'm going to show you a couple more, and then I'm going to give you an idea how to combine them. If I get down on my knees, will it work? So for the shoulders and for building strength, and for the neck, you get down in front of it. You put your hands here, here, or here. You can do wide for more, here for narrow. You can choose your weight, like going forward or back. If you lower your chest down, you slide the scapula together. If you want to get strong, you do a regular push-up. You can do it on your knees if you're a girl. If you're a tough guy, you do a regular push-up like this. And you do them slow
With the machine on.
with the machine on.
Okay.
Now, some of you have disc problems in the low back. You can back up and sit down. And a lady today who has head forward posture. I put her on the machine, had her bring her shoulders back, her head back, her arms up, get her shoulders back. Now it's running. Okay, pretend it's running. And then just stay there and let it work. I told her to get a weight, like a 3-pound weight. When I do mine in the morning, I use 10. But I do a lot of different things with the arms and the shoulders to help the shoulders. You change positions with the elbows, the wrists, the shoulders. And you have to go to the side to work the low back more on one side. Then go to the other side to work the low back more on that side. The last thing you do is turn oblique. Or if I do oblique, that creates a different motion. That motion goes all the way up the spine. And then do the other side. I can slide it forward and get more lift on one butt. And set it back and get more on the other side. I do this for 2 minutes. If done a workout on the low back, it's better than any workout you'll get if you go for physical therapy. And
So
you get
what
up-
speed do you do that on, what you're doing, like 2? What speed do you usually do?
Keep in mind, I've been doing this for a long time.
Right.
So I do what's left on the program.
Oh, okay.
Now, when I turn my program on 5, it starts at 25. Like that sheet says, every 30 seconds,
This is in the book, this
Yeah.
chart.
every 30 seconds, the speed will change automatically. At that time, to save me time, I go on to program number 2. It starts at 75. So it starts fast. And it takes me about 2 or 3 minutes. I do about 2 minutes standing. I sit down, do a couple positions, then go to bed. And it helps me sleep better because it relaxes more. Okay, we've covered a lot of material. So, every quarter I do this class. Some of you've been here before. I recommend you modify what you're doing. Oh, let's go show you one more thing at that time. So, combined therapy. I can widen my feet, turn them out, and do therapy on their knees, the circles, and then I'm strengthening my thighs, my calves. I'm also going to do my chest, my neck, all one time. Okay? You can do multiple therapies. Do it sideways, go up on the toes, and turn the head, tip the head, lean the neck, tip the head, lean the neck. You can do a low back therapy. You can slide back. This is good for osteoporosis by bouncing. When you bounce, you get an addition of what's called G-force. Every time I hit the bottom, and it throws me back up. My body weighs more at the bottom because it's going down. I'll give you an example. Would you be a guinea pig? 10-pound weight.
10-pound weight.
10-pound weight. Just hold it. No, you can, no problem. Now, if I take it out of his hand, raise it up the same distance that this goes like this, watch what happens when I drop it into his hand.
Wow.
Oh,
That's called
upper
G-force.
wrist.
That's called G-force.
Wow.
That's what's happening every time it tips. Every time it tips. but it's up here on the soft cushion, so it's smooth, it's easy. Now on this unit, when you hold on to here, it also gives your heart rate on this light, on this set of lights right there. If that's important to you, it will say 76 right now, so I know what my heart rate is if you want to know. If you let go, it goes away. This one counts. Every time it tips, it counts. When I do my 12-minute routine in the morning, it tips 3,700 times. Now, when you first start, you only do about 500 or 600 or 700 times until you get used to it. Okay, thank you very much. I hope this has helped all of you. If you don't have a TZone, this is on Liberty sale. They sell for 24 on the dealer. I can discount. The discount on sale is 22 plus I get $100 worth of credit for care.